Alex Sobel.
Thank you, Mr Robertson. It's a pleasure to serve under your chairing. And I'd like to congratulate my honourable friend, the member for Putney, for securing the debate and making an excellent opening speech. Although she's been here quite a short time, she's becoming an exceedingly accomplished parliamentarian. Underfunded for years, future funding cut, and now expect to work a time where the new variant is more transmissible when most others are instructed to stay home. Decisions this government is making with a nail in the coffin for many providers. There will be a shortage of childcare space when society returns to more normal times. These are not my words, but the words sent to me by a manager of an early years setting in my constituency. They deserve better. On Saturday, I sent out a short survey asking for childcare providers and staff and parents to respond in advance of this debate, although I didn't at that time know I'd be chosen, certainly not quite so high up in the call list. Just prior to the start of this debate, we had 748 responses. I'd be happy to pass them on to the Minister because I can only use a small selection in the debate today. It's not before time that we discuss earlier settings in this place. Since the start of the pandemic, while subject schools has rightly been discussed and debated widely, earlier settings have been largely ignored by the media and neglected by the government. During the first lockdown, nurseries and providers wrote to me anxious about their future, stuck with very little government support, depending on the continued support of parents. The Early Years Alliance in October warned that as many as 1 in 6 settings could close as a direct result of the lack of support given during the crisis. Nurseries in my city and across the country relied financially on parents continuing to pay their fees, often at significant cost, while their children remained at home. Little over a week ago, earlier settings were plunged once again into crisis. Having opened up all the schools on Monday, the Prime Minister then reversed decision on television, closing all the schools from Tuesday morning, but asking all the earlier settings to remain open. Earlier staff in my constituency were and still are very concerned that their safety is deemed less important than their counterparts at primary and secondary school. Amanda, a staff member in a setting in my constituency, said, "I don't think this decision reflects how important early years staff are. We feel forgotten and very put upon. We feel unprotected. Does our health not matter? Social distancing in early years is impossible." Amy, a childminder in Leeds, said, "We can't wear PPE, we can't socially distance, and we're regularly coughed, sneezed and spat on as part of our job. I accept this puts me and my family at greater risk. However, there is no recognition of this from the government. It feels though earlier staff are being thrown to the wolves for the sake of keeping parents working." Just hours after the Prime Minister's announcement, settings in my constituency were in crisis. Staff were scared and did not feel safe, protected or valued by the government. Some chose to close on Tuesday anyway in order to fully assess the situation and conduct a proper assessment of the risk the staff are being asked to take. And this risk is significant. Jill, an early years teacher in Leeds North West, described the risk she takes every day. She told me, "I'm 56 with a history of cancer and lung problems. My husband is 75 and I'm my mum's support. She's 85 and hasn't been vaccinated yet. I'm very worried that contact with so many children who can't social distance put myself and my family at risk." Lindsay, a childminder, said she feels obliged to earn and play her civic part, but is juggling homeschooling 4 of her own children. She had to tell them they cannot visit their father, who is on palliative care, due to the children she is obliged to invite to their home. The government point out there are good reasons for making an exception. They point out that for children at this crucial age, there is no online substitute available for nursery or preschool education. And that is true. There is no doubt that another lockdown would have significant detrimental effects on young children, who all depend on their routine and their social interactions. Early year settings provide a lifeline for children who suffer from difficult or chaotic home lives and are a key weapon in reducing educational inequality. For parents, reactive, unpredictable and knee-jerk decisions have brought huge anxiety to their families. Many are worried about the effect of another closure, not just on their own working lives, but for the psychological effect on their children. But these facts beg important questions. Why is it the government recognise the value of early years education only after they have asked staff to go on the front line? Why has almost every other frontline worker been promised early vaccination except for these vital members of staff? Last week I put down a written question asking the Minister to prioritise earlier staff in the vaccination effort. She wrote back saying, "JCVI advises the first priorities for the COVID-19 vaccination programme should be prevention of mortality and the maintenance of the health and social care systems. At the risk of mortality from COVID-19 increase with age, prioritisation is primarily based on age. Regarding the next phase of vaccine rollout, JCVI have asked that the Department of Health and Social Care consider occupational vaccination in collaboration with other government departments. The Department for Education will input into this cross-governmental exercise, and I hope that educational staff, including area settings, will be vaccinated as soon as possible. In short, Mr Robertson, there is no saying if and when those member staff will receive the vaccine. And it's been clearly stated by respondents to my survey that the urgent need for the vaccine for frontline earlier staff is one of their paramount concerns. They need a firm commitment and timeline for this. Asking them to wait the outcome of a cross-governmental exercise is simply not good enough. Yesterday, less than 24 hours ago, I was stood here and actually spoke before the Honourable Member for Winchester. Today I'll speak afterwards, but I think we are of one mind on this, advocating for a 24-hour vaccination programme. And I repeat this call now. There are very few staff that I've spoken to, and as I said, we've had 748 responses, who would not go out of hours to ensure they were protected from the virus. If we cannot do that, then it would simply not be morally defensible to ask staff to go to work when they do not feel safe. The second thing that staff, providers and parents need from the government, if settings are to stay open, are clear guidelines and measures in place to ensure those guidelines are being met. The working environments being reported back to me are patchy. Many earlier settings have ensured small bubbles and good safety procedures, but I'm hearing worrying reports of bubbles of up to 40 children and very little protection for staff. PPE must be made available for all staff in earlier settings, and mask wearing must be a requirement for every parent or visitor to that setting. Thirdly, we need clarity over the risk. We need to understand the full science behind every government decision, especially when asking people to work on the front line. Many workers in childcare settings worry about the accuracy of information on earliest contraction. After all, we know how difficult and pleasant tests are to administer ourselves, let alone a toddler with a temperature. Finally and crucially, earlier settings need a commitment on funding. In this year of all years, the funding of a setting should not depend on 2020 or 2021 attendance. Settings where parents have opted to withdraw children to protect them and staff should not be punished, and those settings should not have to suffer financially. I'd like to underline the point made in a letter written by Leeds City Council to the Minister for Vaccine, the member for Stratford-upon-Avon, that calls for funding based on 2019 attendance with a view to a sustainable long-term funding model for the sector. As Helena, provider of my constituency, warns, many earlier settings are already on a very tight budget and cannot afford to open the reduced numbers and income. There's a real possibility that many groups will be forced to close permanently. This is a question of value. We know how crucial earlier settings are. We know how crucial the staff are. But we cannot ask them to work in an environment where they simply do not feel safe. There does not have to be a binary choice between protecting staff on one hand and ensuring provision on the other. This crisis has taught us anything, is that we cannot afford to undervalue our key workers and key institutions. We cannot wait until another crisis before we're back in this place. During the financial future of our earlier settings and improving outcomes for staff and for families, and most crucially for children, I'd like to end with a quote from Nikki, who's a child provider in Leeds. She believes that once it is safe to do so, we must all visit settings in our community, she said. MPs need to listen to staff and owners when we say we need help, to listen to the voice of children and see firsthand how hard staff work with no regard for themselves to ensure that children are cared for, loved and reassured. Thank you.